There are tools that can help you assess a person's readiness to change. For example, asking them the good things or less good things about their current behaviour. Asking them to look back to a time when the behaviour wasn't a problem, or look forward and ask them what they see if they continue with their current behaviour. A similar question is asking them about two possible futures, what the future would be like if they continue with the current behaviour, and how they see the future if they manage to change the behaviour.
When you say you've been feeling very frustrated about all of this, does that mean that you're considering stopping treatment?
Well, I have done, yeah, basically.
So you're saying you have stopped?
Well, I've stopped, actually. I haven't told the doc that, but I've stopped.
OK, and do you know how long ago that was that you stopped?
It was probably around about 2 weeks ago.
And how does life feel now that you have stopped?
So much better. I feel that I can live again, really.
So you're saying to me that right this moment, things feel better, that you can live again, that treatment actually has been a real burden for you?
Yeah.
That's what it feels like now. I'm just wondering, if you kind of look into the future, say maybe 5, 10 years down the line, not taking treatment, what do you see for yourself further in time?
Well, I guess if I don't carry on taking it and get really unwell, then I'm going to die at some point. So I know that I should take them, but I just don't feel like taking them at the moment.
So it's not that you're saying that you're never going to take them again, it's just right now it feels very difficult to take them.
Yeah.
So can you see a time when you could start treatment again?
I think if my CD4 count started to drop or I became unwell, then maybe I'd probably think about taking them then. Obviously I don't want to wait till that point, but I just want a bit of space to actually be myself and live life, really.
I kind of hear you saying two different things there. You're saying, you know, you want to stop treatment now, and you wouldn't want to restart until you became unwell. But there's also part of you that seems to be saying, actually, you would like to start before then, so that you don't become unwell.
Well, I know that's what the docs are saying, that you don't want to be unwell, you know, that by taking the medication effectively and adhering to it, I think they say, then that would, you know, be beneficial to me. But, you know, so I know that they're telling me for my own good, but sometimes I just want a bit of a space from it all.
Okay.
You can assess a person's readiness to change by asking scaling questions relating to importance and confidence.
So how important, if we had a scale, say, of 1 to 10,
Okay.
how important do you think it is for you to be using condoms in the sex that you're having?
10 being...
10 being it's really important for me to be using condoms at the moment, and 1 being it's not very important at all for me to be using condoms.
About 5, I'd say.
Okay, so you'd say 5, so you kind of place yourself right in the middle there.
Yeah.
Okay. Could you give me some reasons as to why sometimes it could be okay or enjoyable for you to not be using condoms?
It feels maybe more intimate or more, I don't know, more horny, I suppose, when I'm with someone and not using it. Although I am aware that that does put me at risk, which is probably why it's maybe halfway between the bottom of the scale and the top of the scale.
Okay, so kind of reasons for not using condoms can be about intimacy.
Yes.
Makes you feel more horny.
Yeah.
The fact that it can interrupt the sex that you're having. But you've also just begun to talk as well about the other 5, which is about reasons why it might be important to use condoms.
Yeah.
Tell me a bit more about that.
Well, I suppose the main one is infection. Obviously HIV and other STDs and stuff.
You can also explore a patient's goals with them, or ask them to talk you through a typical day to see how their behaviour fits into their way of life.
It's a bit like back to earth with a bump sort of thing, you know?
Yeah.
Feels...
Could you talk me through, I'm just trying to get a sense of how it goes at the time. Could you talk me through a typical night maybe where you might have sex without a condom? Just
Yeah. I mean, well, it's usually a Friday night, you know, and it'd be after work. I work quite long hours and I work with a team, so it's in sales, and if we've had a good week but it's been stressful, we usually go out for drinks on Friday night. I usually start out with my work colleagues. We have quite a lot to drink, and then some of them go home, and then I'll go on to another pub where I know quite a lot of the people there, and I have more drinks and sometimes some shots and things, and then you know, get quite horny and sort of end up taking somebody home or going home with somebody from the bar, and sort of getting caught up in the moment, and then having sex with them, and then sort of going home afterwards or staying at theirs or whatever. But it's sort of I sometimes have sex with the same people because they're in the pub, so I know them, and I think because I'm having sex with them all the time, it feels like I know them because they're in the pub.
Familiar, maybe. They're familiar
Yeah.
people to you, and you familiar to them.
Yeah, and so it sort of happens, and then of course, then the following day I'm usually very hungover and usually feel really bad about what's happened, and then I don't go out for a while, you know, after it. So.
And what about the discussion about sex itself? Or maybe there isn't a discussion. Is there any talking about the fact you're going to have sex, or whether someone's positive even, or if you're going to use condoms or not, or how does... Or
I mean,
it
doesn't happen.
There isn't a conversation about that?
I don't think so. Well, not that I can remember, because I'm usually quite drunk by the end of the night. But I don't really... I think it just... You sort of can tell, can't you? You can just see somebody and it happens, and then before you know it, it's happening and you're there, and then it's over and you feel bad about it, you know.